Welcome to your Carevix training, brought to you by AG Health. This video will demonstrate how to assemble the Carevix device, generate the vacuum, then hold and release the cervix. Scan the QR code to visit our website for more information on Carevix. Now we'll get started. Carevix is a suction cervical stabilizer to grasp, hold and manipulate cervical tissue. Please read the instructions for use, which is accessible via QR code on every box of Carevix before using Carevix. Correct use of Carevix. Open the box from the side. Open the sterile package on the chevron side. Follow standard medical practice to handle a sterile Carevix. Assemble the device by connecting the suction head to the main body. Align the connecting thick marks found on the suction head and the main body. Rotate only the main body clockwise until it stops and the thin mark on the main body is aligned with the thick mark on the suction head. Check the button position. The side with the solid oval should be positioned up. If not, push up the button. Generate the vacuum. Outside the patient, pull the piston away from the main body until it stops generating the vacuum. An arrow will be visible at this point. Rotate the piston counterclockwise until it stops. Two thin marks will be aligned. Disinfect and dry the cervix with a sterile swab. Place the suction head firmly against the cervix at the 3 o'clock or 9 o'clock position to achieve a good seal. Evidence from real-world studies showed that Carevix creates good suction for both anteverted and retroverted uteruses when placed in the 3 or 9 o'clock position, but can still be placed at 12 or 6 o'clock if necessary. Press the button to deliver the vacuum, release any traction on the Carevix device, and wait 10 seconds. 10 seconds are necessary to create the strongest vacuum and enable the most secure seal. Manipulate the cervix. Carefully pull the Carevix device slowly, perpendicular to the uterus, making sure to maintain the seal with the cervix. When Carevix is used alongside an intrauterine device inserter, it is necessary to adjust the position of the flange by adding 1 cm to the measurement performed with the hysterometer. Such as for a hysterometer of 7 cm, the flange should be placed at 8 cm. This video demonstrates a coil insertion. However, Carevix can be used for any trans-cervical procedure that is compatible with the size of the Carevix head. The adjustment of adding 1 cm is made because the flange meets the suction head. As shown here, adequate traction can be applied to allow for appropriate placement of the coil. Cervix release and removal of Carevix. Press the button side with the hollow oval shape upwards to release the vacuum. Disposal. After use, discard Carevix according to local regulations for biohazardous waste. Now we will demonstrate using Carevix during a real procedure. As per the IFU, the physician sterilizes and dries the cervix, and in this case, the physician places the device in the 9 o'clock position. Carevix is also well suited for multiparous subjects with a horizontal external ostium. The physician pulls slowly to align the Carevix device perpendicular to the uterus. To reset the Carevix device, in the case of spontaneous release, make sure the solid shaped side of the button is still pressed down. Rotate the piston to unlock it and push the piston all the way down. Push the solid oval side of the button back up before regenerating the vacuum. Pull on the piston and lock it into place. Carevix is now ready to be used again. 4 tips to become a Carevix master. Firstly, ensure there is good contact with the cervix. Push down enough to create a good seal before pressing the button. If you hear airflow, it means a good seal was not created, like you hear now. If this happens, reset the Carevix device. Tip number 2. Don't place the suction head too close to the cervical canal as it won't create a proper seal. Place the suction head a few millimeters away. If you hear a whistling noise, it means a good seal was not created. If this happens, reset the Carevix device. Tip number 3. Push on the cervix to create good contact. Press the button to activate the vacuum. Release pressure on the tissue to allow the tissue to move into the suction head, ensuring a good seal, and wait 10 seconds. You can try on your hand or your forearm with a demo device to replicate the sensation and see how waiting 10 seconds affects the strength of the vacuum. And our final tip, pull perpendicular to the uterus to prevent the seal breaking. Training resources are available on our website or through your local account manager, including e-learning, an online simulator, IFU, and more. Thank you for watching, and we hope you enjoyed this video.